All right, guys, sorry to have to break this to you. There's a study out here that shows that consuming eggs now will clog your arteries and actually kill you prematurely. So I'm going to have to delete all my videos now on eggs and cholesterol and completely recommend a different thing, because according to this study, associations of dietary cholesterol or egg consumption with incident cardiovascular disease and mortality. I'm going to have to completely change my recommendations according to this study. And here's the conclusion. Among U.S. adults, higher consumption of dietary cholesterol or eggs was significantly associated with higher risk of incident of cardiovascular disease and all-cause mortality. Basically, eggs are going to kill you. Now, I hope you guys realize that I have a very dry sense of humor, and this is sarcasm to the extreme, because this study is BS on steroids. So the people that are using this study to prove the point that eggs are bad either never read it, they don't understand it, it's over their head, or they hope no one reads it. Let's go through the points. The first thing you want to do when you look at a study is find out who funded this study, okay? Well, multiple pharmaceutical companies and other related businesses who profit from the results. Check this out. Conflict of interest disclosures. Dr. Wilkins reported receiving consultation fees from NGM Biopharmaceuticals. And then Dr. Mentz reported receiving research support from all sorts of companies, including AstraZeneca, Bayer, GlaxoSmithKline, Medtronic, Merck, Novartis, Abbott, and the list goes on and on and on. So right there, I could pretty much stop. That's a huge conflict of interest. How are these researchers going to be unbiased? They're getting paid by companies that possibly have another interest. All right, next point. This was an observational study, okay? The data was taken from 6 other studies over 17.6 years with 29,615 people between the ages of 34 and 79, both men and female. Now, an observational study is a study which uses a food frequency questionnaire. This is not a clinical study where they're using randomized controls. No, they're using a questionnaire over a period of 17.6 years. That is so subjective. How is someone going to remember what they ate even last week? And they don't tell you how frequently these questionnaires are passed out. It could be a year. It could be every 5 years. Who knows? But the point is that this is not objective. It's not reliable. A study is only as good as the data is true and credible. So self-reported questionnaires are at the lowest bottom barrel of scientific studies. All right, next thing. What did they evaluate? How many variables did they look at? 1. They based this very strong conclusion on looking at one thing: eggs. That's it. And eggs associated, cardiovascular disease and death. Did they look at whether the person ate donuts, their sugar level, carbohydrate content, the stress level? No. How about smoking? No. How much exercise they did? Absolutely not. Soda consumption? If they had diabetes or not? No. None of this was looked at. That was all omitted. They looked at one thing: eggs. So realize too, when they use the word association, that has nothing to do with causation, cause and effect at all. So another term for this is misclassification bias. That's really what they're doing. All right, let's look at a couple other things here. Number 1, the data is just not reliable. The questionnaires, very subjective, have the lowest credibility. They were only looking at one variable. No blood test. They didn't look at your LDL, HDL, the type of LDL. They didn't look at other reasons why these people had heart failure and died. Like, what about cancer, HIV, liver? I mean, a person eventually is going to die and the heart's going to give out. It's not always a clogged artery that causes the heart attack. There are other reasons. They didn't look at that. And also, they didn't mention all the studies that show opposing findings, okay? So you can see there are quite a few studies that show no relationship between the intake of eggs and serum cholesterol. Here's another one. Total dietary cholesterol levels have no significant effects on plasma LDL. Here's another one. Found no association with eggs and cardiovascular disease. Dietary consumption of eggs was not associated with cardiovascular disease. Here's another one. No association with cardiovascular disease. And here's another one, 2009 by Jones. No association between egg consumption and cardiovascular disease. All right, guys, in summary, anytime someone uses science to prove something, make sure you personally look at the study, see if the data is truthful or not, because this study is just complete and utter BS. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications.